The Ministry of Health, Wellness and the Environment officially launched the National Health and Wellness Commission of St. Vincent and the Grenadines on Tuesday, the 31st of October 2017 at the National Insurance Services Conference Room. Minister of Health, Wellness and the Environment, Honorable Luke Brown, gave the featured address. The National Health and Wellness Commission will be headed by Chairperson Dr. Timothy Providence. It will comprise of 14 members drawn from among government ministries, non-governmental organization, private sector, the media, and faith-based organization. The commission will serve for a term of 3 years.
Welcome to this official ceremony to mark the launch of our National Health and Wellness Commission. It has been quite a while since we have been expecting this launch of the Commission. Significant groundwork went into place by former Permanent Secretary, also members within the Ministry of Health and others from other ministries, for which there was a task force which was instrumental in putting together a set of TORs. And just to recognize the effort that went before. But you'll hear more about that when our chairperson and minister address you this morning. I specifically want to recognize the distinguished commissioners. I will now ask the chairperson of the National Health and Wellness Commission, Dr. Timothy Providence, to bring us brief remarks.
The room today, I see the vast majority of persons here today are, in fact, members of working in the healthcare business. And so I will be very brief in stating a few facts concerning the genesis of this commission. Way back in 2007, that's how long we started, the CARICOM heads of government had a declaration of Port of Spain. In 2011, the United Nations had a very high-level meeting on NCDs, and indeed, locally in St. Vincent Grenadines in 2013, there was a meeting. All of them recognized that the NCDs, the non-communicable diseases, pose a threat to the socio-economic development of countries. And they all recommended the establishment of this NCDs Commission to aid in the fight against these diseases. As the workers in the health field would know, health is not only a business for the Ministry of Health and healthcare providers, but also for the entire community. And thus, it was felt that this commission should be broad-based and should include the government sector, the private sector, community-based groups, NGOs, people living with the diseases, that is the diabetics and hypertensives, and also faith-based organizations, the media, among others. So that is the focus of which the persons, the groups who are supposed to constitute this commission. In 2015, if I recall, the Ministry of Health, in conjunction with the Commonwealth Secretariat and Healthy Caribbean Coalition, convened a meeting in order to get this process in train. And at that time, a task force was established to draft the terms of reference for this commission. The activity today is the culmination of the work of this task force.
The need for the formation of this commission is in keeping with the recommendation of CARICOM Heads of Government Declaration Port of Spain, uniting to stop the epidemic of chronic non-communicable diseases in September 2007. The aim of the Commission is to support the Ministry of Health, Wellness and the Environment in establishing health and wellness policies, responding to threats from communicable and non-communicable diseases, building capacity for community interventions, strengthening institutions and ensuring timely interventions to address regional and international resolutions, commitments and agreements.
I'm happy that we have been able to gather together like this for what is an important moment in the development of healthcare in St. Vincent and the Grenadines. And I'd just like to, at this point, especially acknowledge and recognize the designated chairman of the Health and Wellness Commission, which we are bringing into being today, Dr. Timothy Providence. It is a very great thing that we actually have his kind of experience, medical experience and experience in life at the disposal of this commission, and that he's in a position to head the commission. Dr. Providence, when he spoke, did a great job of pointing out the persons who were involved in this process and who helped to bring us to this point, including former members of the members of the now defunct task force. And that task force was led, and I don't think that we have, in as much as she was mentioned already, given sufficient recognition to Dr. Kitty Israel, who worked diligently and hard at that task force, and I'm sure that her contribution to the purposes, her contribution is not yet complete. So we look forward to further engagement with you. This is just to let you know that you're not getting off the hook. and the other members of the commission, by extension, we thank you all for the work that you've done. We should show appreciation to Lyndon and groups and other persons who lead similar groups that are helping us with the cause of getting St. Vincent and the Grenadines physically active. The recommendation for the establishment of a national multi-sectoral committee to oversee the development or strengthening of national policies, plans and programs was first mooted in the Non-Communicable Disease Prevention and Control Strategic Plan for the Caribbean region 2003 to 2007. Endorsement of the multi-sectoral response to prevent and control non-communicable diseases was subsequently expressed in 2007 by the heads of government of the Caribbean community in the historic Port of Spain Declaration entitled Uniting to Stop the Epidemic of Chronic Non-Communicable Diseases. So it was given, there was an expression of support for it in 2007, and national non-communicable disease commissions or analogous bodies were determined to be the mechanism or instrument for the implementation of the multi-sectoral response. At the United Nations Non-Communicable Diseases Review meeting in 2014, a multi-sectoral approach was explicitly recommended and the creation of NCD commissions endorsed. The resulting statement defined an NCD commission as a high-level commission, agency or task force for engagement, policy coherence, and mutual accountability to implement health in all policies, an important word in the jargon, to implement health in all policies and whole of government and whole of society approaches, and to monitor and act on the determinants of non-communicable diseases, including social and environmental determinants. So, health in all policies, in everything, there is some connection to health. A whole of government approach, so don't think that it's just the Ministry of Health, Wellness and the Environment. And this commission which we are setting up today banishes that myth hopefully into extinction. That is not just the Ministry of Health, Wellness and the Environment that is responsible for taking care of the health of society. We need a whole of government approach. And we see that whole of government approach reflected in the composition of this commission. We have the Ministry of Foreign Affairs, we have the Ministry of Education, we have the Department of Sports, which is in the Ministry of Tourism, Sports and Culture. We have the NIS, we have faith-based organizations, we have the media, we have the Ministry of Education. I don't know if I mentioned Ministry of Education before, and we have the private sector. And this reflects the whole of government approach philosophy. And beyond whole of government approach, we need to have a whole of society approach. So beyond the ministries and public agencies, we have private sector involved. And it was so organized as well that in terms of the terms of reference, which were approved by the cabinet, that the determination was for the chairman to be either from the public sector or the private sector, and for the deputy chairman to be from the other sector. So it's not a case where we're going to end up with a commission on which both the chairman and the deputy chairman come from the same sector, be it public or private. And thus, you have Dr. Providence in a private capacity, and we have Brother Hillocks in a public sector capacity. So we are guided by what came out of that United Nations meeting, which directed us along this path. In St. Vincent and the Grenadines, on the 30th of October 2015, the Ministry of Health, Wellness and the Environment, in collaboration with Maisha Hutton, Executive Director of Healthy Caribbean Coalition, held an inaugural meeting at Beachcombers Conference Room to discuss the setting up of a non-communicable disease commission for St. Vincent and the Grenadines. The name was later changed to a National Health and Wellness Commission. So in other words, we, adopting a policy we thought more appropriate to St. Vincent and the Grenadines, went beyond just non-communicable diseases. It is a more broad base, even though non-communicable diseases will take up a lot of its work. But we didn't seek to restrict ourselves in that kind of formulation for the name. The first meeting of the task force was held on 3rd November 2015, 2 years ago, almost to the day, on the 3rd November, the task force held its first meeting. So it took 2 years from the first meeting of the task force for us to be here. But that's okay. We're at the finish line as far as the task force is concerned, not at the starting line from the Commission's standpoint. At that meeting, Dr. Patricia Kitty Israel was elected chairperson of the task force, with Dr. Timothy Providence elected as deputy chairperson. The task force comprised 10 other members drawn from other ministries, private sector, faith-based organizations, and the media. The members of the task force worked assiduously to develop the terms of reference for the establishment of the National Health and Wellness Commission. Further technical cooperation was received from Healthy Caribbean Coalition and the Commonwealth Secretariat in the person of Dr. Beverly Barnett, public health consultant, in the finalization of a framework for the establishment and strengthening of the National Health and Wellness Commission. On July 1st, 2016, Cabinet granted approval for the establishment of a National Health and Wellness Commission. The aim of the Commission is to support the Ministry of Health, Wellness and the Environment in establishing health and wellness policies, responding to threats from communicable and non-communicable diseases, building capacity for community interventions, strengthening institutions, and ensuring timely interventions to address regional and international resolutions, commitments, and agreements. Some areas of focus for the Commission would be, and these areas are just lumped into 3 broad categories. 1, as you'd imagine, non-communicable diseases. And within non-communicable diseases, there will be a focus on the risk factors related to non-communicable diseases, and anybody who is in the Ministry of Health could recite these risk factors by heart now: tobacco, alcohol, diet, and physical activity. So they look at that work, they look at work related to screening for cancer, look at work related to diabetes and cardiovascular diseases. Another broad area would be matters related to communicable diseases, and in this group of communicable diseases we have HIV, other sexually transmitted infections, vector-borne diseases, emerging and re-emerging diseases, and new diseases, and several Several things fit into this category, including chikungunya and Zika, with which we've had to grapple in the past couple of years. And then the other area of focus will be on wellness and the things concerning wellness. So tell us about healthy eating, healthy behaviors, healthy schools, healthy workplaces, and population-based health. Now there's some initiatives around the Caribbean that relate to these things, and I'm sure that there will be some recommendations emanating from this commission very early on, as soon as it gets to work on what we might be able to do on some of these fronts in St. Vincent and the Grenadines. Now to talk a little bit about the non-communicable diseases situation in St. Vincent and the Grenadines. In 2015, an estimated 39.5 million or 70% of worldwide deaths were attributed to non-communicable diseases, mainly cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases. Of these deaths, nearly 80% of them, or 29 million, occurred in low and middle income countries like St. Vincent and the Grenadines. Non-communicable diseases are the most frequent cause of death in most countries, exceeding deaths from all infectious diseases, including HIV, malaria, and tuberculosis, maternal and perinatal conditions, and nutritional conditions combined. So you get a sense of the scale of the problem presented by non-communicable diseases. They exceed, the deaths from non-communicable diseases exceed deaths from all these other types of conditions, not individually, not in pairs, but all of them combined. That's a big problem. While deaths from infectious diseases, perinatal conditions, and nutritional deficiencies are expected to decline, deaths from non-communicable diseases are projected to increase by 15% globally by 2020. So it's already bad that we have a situation where the non-communicable disease deaths exceed the deaths from all these other conditions, yet we're expecting the deaths from those conditions to decline further and the deaths from non-communicable diseases to increase. So the gap that exists between them is going to naturally widen. Similar to global trends, so that's the global picture. We're going to talk about this in the context of St. Vincent and the Grenadines now. Similar to global trends, St. Vincent and the Grenadines is experiencing an increasing mortality attributable to non-communicable diseases. While mortality attributed to infectious diseases show significant decreases. So the world picture is showing one thing, and this is reflected in the St. Vincent and the Grenadines situation. Over the last decades, malignancies, cardiovascular diseases, and diabetes have been among the leading cause of death, with malignancies remaining the #1 cause of death, and shows an upward trend from 122 deaths in 2010 to 168 deaths in 2014. Mortality from cardiovascular diseases has been the second leading cause. In addition, injuries and violence and mental health disorders are significant health problems, and these would be issues or problems with which the Commission would naturally also be concerned. Non-communicable diseases are the leading cause of mortality and morbidity in St. Vincent and the Grenadines. These chronic diseases dominate the healthcare needs of the population and therefore place the highest burden on the St. Vincent and the Grenadines healthcare system. In St. Vincent and the Grenadines, 76% of deaths in the age group 30 to 69, and this is defined to be premature deaths. So deaths in this age group are premature. I think they're guided by the biblical idea that the days of our lives should be 70. So once you die before that, you die premature. And when we talk about these premature deaths from non-communicable diseases, it doesn't take away from the fact that people die in the 70s and 80s from non-communicable diseases as well. So we're just talking about the premature deaths from non-communicable diseases and not the total number of deaths from non-communicable diseases. Because, for instance, my grandmother, when she died at 82, she had diabetes and she had hypertension. She is not among the premature deaths from non-communicable diseases, but she still died as a result of it. So, in St. Vincent and the Grenadines, 76% of deaths in the age group 30 to 69 were caused by non-communicable diseases in 2013. Out of that, 64% of them were caused by the four main non-communicable diseases, namely cancers, cardiovascular diseases, diabetes, and chronic respiratory diseases. Both hospitalizations and health center visits have increased significantly since 2009. In St. Vincent and the Grenadines, cardiovascular diseases occur primarily among men, while diabetes and cancers impact both men and women more equally. These facts, coupled with the evidence that modifying risk factors can largely prevent the onset and progression of non-communicable diseases, reinforce that the prevention and control of non-communicable diseases are a public health priority requiring urgent action. So it is a big problem, but it is not a problem about which we can do nothing. It's a problem that we could tackle head on and see results. That's why we're not standing up with our arms or hands tied behind our back or putting up or throwing up our arms in the air. We are actively pursuing a policy and an approach that could bring results. And we see the wisdom of the international health organizations and the wisdom of our own experience tells us that to have a dedicated body like this National Health and Wellness Commission would help us to make progress in the fight against non-communicable diseases. There's a significant need for an effective coordinated response that is multisectorial and addresses the social determinants of non-communicable diseases to strengthen healthcare for people, to develop enabling healthy environments, and to support healthy individual behaviors. In addition, there is a need for a radical reorientation of the healthcare system towards service delivery models for chronic care, as well as a strong focus on health promotion and partnerships with non-health sectors and communities. This reorientation involves strengthening the national primary healthcare systems to be able to take on a role in the prevention, early detection, and management of non-communicable diseases. And the Health and Wellness Commission would no doubt assist here. In fact, this is one of the things that I advocate for strongly. I believe that we need to have perhaps community-based health teams, maybe organized around our clinics, that more or less keep a tab on what is happening in these communities from a health standpoint, whatever it may be. I don't think it is beyond us to organize ourselves in such a way that a clinic could identify within their jurisdiction the persons who might be at risk of non-communicable diseases, the persons who might need a particular type of intervention, the persons who might have a problem because they're not able to access proper foods because of maybe their income or some other issue, the persons who might be at risk of some adverse health condition and assisting them. And at the same time, when we have initiatives to roll out, like one of the things we have identified here is the need for us to screen for cancers. When we have those things to roll out, they could be rolled out through the clinic again. That is going to take a lot of burden off the system. That is going to pay tribute to the old idea that prevention is better than cure. And that is going to reduce the cost of the delivery of healthcare in the first place. So that is an all-round winner for everybody. So, as far as some guidance for the National Health and Wellness Commission is concerned, I'd like you to take up that issue on whether or how rather, we will be able to effect this renewal of primary health care and the aspects or the dimensions that the renewal could take. Maybe a roadmap for unrolling this renewal. I'd also like to make the point that disease-specific guidelines are urgently needed for each of the main non-communicable diseases categories, and I've named them before and I'll name them again here: diabetes, cardiovascular diseases, cancer, and chronic respiratory diseases. So the Commission could assist here as well. What do we want to do specifically in relation to each of these diseases to have an impact on health outcomes, to reduce the incidence, to reduce the mortality, to reduce the morbidity from them? Now, we engaged in a very important exercise in from November 2013 to April 2014, where there was the administration of the National Health and Nutrition Survey of non-communicable diseases risk factors in St. Vincent and the Grenadines. The survey was a population-based survey for adults between the ages of 18 and 69. A total of 3,513 adults participated in the survey. The data from the National Health and Nutrition Survey shows or gives some insight regarding lifestyle and behavioral factors around non-communicable diseases. 61% of those surveyed were physically inactive. 27% of those surveyed were obese. And 21% had high cholesterol, had high total cholesterol. So you see what's happening in this society. So you know exactly what the situation is and how we need to respond. In addition, the Global School Health Survey 2007 among children aged 13 to 15 years showed that 13.3% of children have physical activity of less than 1 hour per day. The schools, through physical education and in other ways, could address this. I hear that we have PE teachers who don't like to go outside with the children, and that we're beginning to teach PE in our schools as if it's an academic subject. You put up on the board the importance of exercise. You understand? It helps you to do this, this, and this without going out and exercise. And one of the most contradictory sights you could ask for is a PE teacher who is badly overweight. That doesn't send the right signal. So let us take the results from our survey seriously. We can, and there's another thing that I've observed. There's some schools that don't have a sports day. Or at least, I know last academic year, there were at least a couple of schools without having school sports. That is really unacceptable. I mean, because, let's face it, for some students, sports is as important as academic pursuits. So, if we can have a school without maths and English and science and social studies, why are we having a school without sports? So I want serious steps to be taken in relation to this. And I also believe that we need to elevate the standard of sports and physical activity in different ways, including by putting a lot of emphasis into perhaps the inter-school sports meet, putting a lot of emphasis into cricket competitions at the school level and at the community level and other levels, putting emphasis into football competitions, putting a lot of emphasis into track and field and other sports in general, so that we could increase the levels of physical activity and address the problem which is identified here. The survey, and this is the Global School Health Survey, 2007 now, the information is a little bit dated, indicated that 40.3% of children spent 3 or more hours per day sitting and watching television, playing computer games, talking with friends, or doing other sitting activities. So in other words, they gain under 1 hour of physical activity, but they gain over 3 hours of sitting activities. Which is what we're trying to address. So that's the situation there. Data from a 2011 Global Youth Tobacco Survey reported that among 1,102 students aged 13 to 15 years, 19.4% of students were current users of tobacco products. So in that age group, 13 to 15 years, almost 20% of students were currently using tobacco products. Something of concern. In addition, the survey indicates that students are exposed to secondhand smoke. So that students exposed to that 49%, well, that students are exposed to secondhand smoke. So in other words, you're not smoking yourself, but you're exposed to secondhand smoke. 49%, and in talking about this exposure, secondhand smoke, it said that 49.9%, call it 50%, lived in homes where others smoked. 70.1% were exposed to smoke around others outside of the home, and 32.6% had at least one parent who smoked. So these are all the various sources of secondhand smoke. So this is another concern. And this brings us to what Dr. Providence recommended for World No Tobacco Day next year. And I agree that we should push public policy in the direction of banning smoking in public places. And I would like to be able to push it on the basis of a recommendation from the Health and Wellness Commission that among the 1,333 Vincentian students aged 13 to 15 years who responded, 53.2% consumed alcohol at least on one or more occasions in the past month. So when they were asked the question, 53.2% of them said that they consumed alcohol on at least one occasion in the past month. 35.1% of them said that they drank so much alcohol that they were drunk on one or more occasion. Our students aged 13 to 15. Is this what our society stands for? Is this not something for us to put all our energy into addressing? This is the serious business of the National Health and Wellness Commission, which is being brought into being today.
NCD Coordinator and Focal Point, Beverly Liverpool, handed over the National Action Plan for the Prevention and Control of Non-Communicable Diseases to the Minister of Health, Wellness and the Environment. Students of the C.W. Prescott enhanced the proceedings with their entertainment.
Looked at my old clothes, brown with stain, and so right through with the God sent rain. He cast off his eyes and turned up his nose and said, "You are a beggar man, I suppose. Be of some value to your nation." And I said, "My God, and this big right hand, you must recognize a banana."
This country is now in a better position with future initiatives towards promoting and maintaining health and wellness in St. Vincent and the Grenadines in place through the National Health and Wellness Commission.